We move on to our next talk by Rakhi Nathawat on advocacy and policy planning to target the goal of eliminating corneal blindness by 2030. Rakhi, please.
Is my screen visible?
Yes, yes.
Yeah. So I think.
Please remove your virtual background, ma'am.
I'm just removing that. Thank you. So, thank you AIOS and thank you EBI for providing me the opportunity to talk about advocacy and policy planning to target the goal of eliminating corneal blindness by 2030. So just an introduction. India was the first country in the world to launch the National Program for Control of Blindness in 1976 with the goal of reducing blindness prevalence to 0.3% by the year 2020. So we were the pioneers basically when we talk about the NPCB. In 1999, the WHO launched Vision 2020, the right to sight, a joint endeavor with IAPB to eliminate avoidable blindness by 2020. Significant evidence on the magnitude of blindness and visual impairment through large population-based survey are available for India as well as on the South Asia region. If we look at the leading cause of blindness, cataract still remains the same, but in the past 2 decades, we have seen improved cataract surgical rates and quality of the cataract surgery has drastically improved. If we talk about the eye care infrastructure and availability of the appropriate human resources, we have a significant variance across the region. Talking about the adequate focus on health system, strengthening, boosting the primary eye care and monitoring and evaluation mechanisms will definitely be imperative for realizing the goal of eliminating blindness from the region in the coming years. If we look at the data from the Global Distribution of Blindness and Visual Impairment Survey in 2010, India is the second highest number, China being the first in the visual impairment. This is a world map showing the leading indication for the corneal transplantation. If we look at the region, India and the Southeast Asia, the infectious keratitis is the main reason for the corneal blindness in our country. This is again a latest survey from National Blindness and Visual Impairment Survey by the Ministry of Health and Family Welfare, which talks about that corneal opacity is the major cause of blindness in population aged 0 to 49 years. If we talk about the Sustainable Development Goals by United Nations, vision makes an important contribution to our 2030 agenda for sustainable development, and it cuts across many of the sustainable development goals. We talk about the poverty reductions, we talk about economic growth, employment, education, gender, reducing inequalities. Everywhere, vision is very important. It is therefore crucial that the countries adopt a whole of government approach to vision, and we need to include eye health in the implementation of the SDGs at the national level as well. If we talk about the SDGs in specifically, if we see goal number 1, which is no poverty, goal number 2, which is zero hunger, and goal number 8, which is decent work and economic growth. Improved vision enhances the economic productivity, it raises the long-term household spendings, increases the household income, and therefore leading to an overall improvement and reducing the poverty, hunger, and promoting the growth. If we look at the goal number 3, which is good health and well-being, it helps sustain the mental health and contribute to health targets on neglected tropical diseases, NTDs, financial protection, and health workforce. So it is therefore a significant driving force. And if we look at the target of SDG tag, which talks about reducing the number of global deaths and injuries from road traffic accident, vision plays a very important role there again. Talking about the quality education, giving a child a pair of properly prescribed glasses can improve attendance and performance at equivalent to half a year of schooling. A big difference in not only in the life of the child, but in the total country's economy as well. If we talk about gender equality, reducing inequalities, blindness and visual impairment plays a very important role. So what is the problem basically? So the problem when we talk about eye care is, it is very poorly integrated with the health system. Problem is of availability, accessibility, and acceptability of eye care services. If we talk about the need is greater in the rural areas, but services are often provided in hospitals in urban areas. So patient can't reach to the hospital at the right time and lack the treatment. So coming to the main topic of policy changes favoring cornea donation, it's nothing new. We keep talking about these things, and now is the time where we start enforcing again on these policy changes. First is the mandatory death notification, which talks about any death which takes place in a hospital should be mandatory notified to nearest eye bank for the eye donation counseling. If we still look at the THOTA Act, it still have the required request law, which talks about any death taking place in the ICU needs to be counseled for the organ and the eye donation. But not many people are aware about it. Not many eye banks are aware about it. So we need to start focusing on that as well. Required request law typically mandates that hospital utilizes the accepted medical standards in articulating policies for identification of potential organ donors. So if these two laws are in place and we start focusing on them, the number of death notified to the counselors will increase, which will definitely increase the number of cornea donations in the country. Another very important change which can be brought is the first person consent. Currently, any person who is even pledging the eye or an organ, the first person consent is not allowed. It's only if the next of the kin agrees for the donation, the cornea or the organ can be donated. This one change can actually dramatically increase the number of donors in the country, because then the pledges will actually convert into donations. Access to trauma centers, mortuaries, and the mandatory HCRP at large and medium mortality hospitals. We all have learned in past 10 years that HCRP is the way to go. Counseling the families at the right time by a trained counselor is the way to increase the cornea donation. So if by law, the eye banks can get access to trauma centers and mortuaries, this one single change can drastically improve the number of cornea donations in the country. Telephonic consent. Currently, the telephonic consent don't have a legal status in the country. But if the telephonic consent is allowed, we can start a call center approach, which can be used to counsel the family members, directly again impacting the actual number of cornea donation. Cost coverage of cornea donation. We all understand that cornea donation currently is not a self-sustainable activity, and every improvement needs money. So the major hurdle in the professional development of eye bank is the cost reimbursement of all expenses. Donations from philanthropists and grant from government is not sufficient to run eye bank and make it self-sustainable. Government currently provides 1,000 rupees per cornea collection to the eye bank, which is not actually sufficient to sustain an eye bank. So if cost coverage is legalized in the form of cornea processing fee, this will surely enhance the standards of eye banking all across the region. When we talk about cornea, we all understand that dependent on the media which we are using, it remains viable for 4 to 14 days. Unfortunately, if there's not a demand of specific cornea with a certain time limit, it may get unutilized if the surgeons are not taking that tissue in from that region. So it is beneficial that this cornea is made available to other recipients as well. CDS by SightLife has played a very important role there, while the tissue from North India was moving to South India, from South India moving to the eastern part of the countries as well. But this also requires a framework for exchange of information. This can be conceptualized as a national waitlist registry, which can ensure that best use of every available cornea, reducing the wastage and smoothing the geographic disparity of cornea availability. And EBI, in collaboration with NOTO and NPCB, can be a nodal agency to maintain such a registry. The issue of tapping into opportunities provided by the pledged organ donation. We all know that eye banks do a lot of activities of the pledging of the eyes, and we get every eye bank must be getting 100 to 200 forms every month. But what actually happens once the person is filling up the pledge form? Because that doesn't materialize into an actual eye donation. So how will authorities dealing with life and death ever get this information that this person has pledged the corneas? The latest amendment in the Central Motor Vehicle Rules in 2018 is a laudable step in this direction because it mandates the capturing of this information and indicating it on the driving license. As per my information, this is currently applicable in Gujarat, Rajasthan, Punjab as well. And there the RTO has put this as a form where any person who is going for a driving license, they have to tick this option of that whether they want to donate or not.
Rakhi, the time is over.
I'll
just wind up. Yeah.
In general, the Aadhaar card is the most frequently used document for identification, and this can de facto become a national donor registry. So this is something which we can talk about with the government as well. This is the latest guest editorial in the policy framework for advancing eye banking and corneal transplantation in IJO, which talks about a lot of policy frameworks. So request if you people can go and read this article as well. Key factors for successful advocacy, as you all know, is generation of evidence, credible eye care leadership, engagement with the policy leaders, alignment with health and development agenda, and to have a media strategy and ambassador. And I know that in the able leadership of Dr. Radhika, Dr. Basak sir, Dr. Namrita Sharma, we can start working on a successful advocacy program for eye banking and corneal transplantation. Conclusion, the potential of cornea donation and transplantation in the country has yet to be optimized. We have to control measures through existing policy exist, but need an enhancement through the policy changes. And to resolve the problem of corneal blindness, India needs to fast track the policy changes. In short, more organizations we can assemble together to say, we want this, the stronger will be the message to the government. So that's it from my side. Thank you.